One other key thing you want to learn when you're preparing for acute pancreatitis is what you call determining the severity of acute pancreatitis, determining severity. And what do I mean by that? We use what we call the Ranson's criteria, but you realize that in Canadian boards, it's not really about what is the Ranson's criteria. No, no, no. But rather, they can pick, components of the Ranson's criteria and then ask you questions about it. This one as well, you don't need to worry so much about these values, but rather about the components. Okay. So if you have a patient who was diagnosed with pancreatitis and the patient is in the ER right now, what are the things you want to do to help you to determine the severity of the pancreatitis, whether or not the patient may deteriorate or whether the pancreatitis is mild? So don't mix the two. We have those which we can do right away and those which have to wait for 48 hours to be done. So if you want to determine how severe a patient's pancreatitis is, as soon as they present, you want to know their age. If their age is more than 55, their risk of developing badness goes up. White blood cell count. If white blood cell count is more than 16, trouble, or it can go to badness. If glucose is more than 11.1, it can go to badness. If LDH is more than 350, it can go to badness. And if AST is more than 250, it can go to badness. Now, what about 48 hours after that? What are the features we use to assess whether this pancreatitis is going to get worse or not? Hematocrit levels, BUN, serum calcium. Remember that I said that in acute pancreatitis, serum calcium levels drop. And then partial pressure of oxygen and base deficit and fluid sequestration. So please, this is what we call the Ranson's criteria. You've got to know which ones can be used way early and which ones have to wait for about 48 hours to be used. And so what the natural history of pancreatitis? The natural history of pancreatitis is that in mild cases, patients recover in 3 to 5 days without complications or organ failure. In mild cases, the patient is likely to recover.